Hi, my name is Jennifer Jackson, and I'm a fourth semester nursing student who just finished my community health clinical. And I'm just going to talk a little bit about what I learned in my public health nursing clinical and what the experience really meant to me. My perception of community health changed, but in a sense, I really don't think I fully understood what community health was before I began the clinical. And after, what I really understood it to be, if I could describe it in one word, would be prevention. We discuss a lot about the primary, secondary, and tertiary levels of prevention in the community. And, what that means is preventing things from happening health-wise in a community, and also preventing, problems from getting worse or worsening. And I think the way that community health nurses achieve this is through education. Education is a key part of community health, and our clinical group achieved that by working with senior citizens at the Good Sam Community Center, the senior citizens teaching them about diet and nutrition and different ways to help, how to cook and have more nutrition in their meals. And I really think that we helped them. Some of the different primary, secondary, and tertiary levels of prevention we learned about in community health. One of them, like I said, we worked with the seniors. Not only did we teach them about nutrition, but we also worked with them, on exercise. We walked around the track, and we often played musical chairs for prizes to, encourage them. And the seniors really enjoyed this, and this was a primary level of prevention because the physical activity helps them stay active and prevents them from becoming too sedentary, and it helps keep them healthy. In community health, we also had the opportunity to have a transportation day. We rode the VIA bus from a certain area in San Antonio to seek health resources in our community. And in my case, I had to ride a bus from my census tract to the University Health System downtown. And that experience really opened my eyes to what patients and clients that we take care of really have to endure in order to seek resources in our community. And this is another example of primary level of prevention because, public transportation allows individuals in the community to get around town and to be independent. Like I said, it's really important not only as a community health nurse, but as a registered nurse in general, to be cognizant of what our patients have to go through, in order to get to the resources. Not many of them not only are uninsured, but, some of them don't have means of transportation, so they rely on the bus system to get around. An example of a secondary level of prevention would be the Mission Reach project here in San Antonio around the San Antonio rivers. It's an example of how San Antonians can get outside and go for a walk, a hike, or a bike ride. That's what I did, is I went for a bike ride with my clinical group. And, there are trails available and so much to look at, and with all that you've done with the river. And this is an opportunity for our population to get exercise. And the reason why it's an example of a secondary level of prevention is because it was a response to the community because of the horrible obesity problem that, San Antonio has been facing the past few years. Obesity is a huge issue, and this Mission Reach project was a means to, face that. And I think that's a really good example of a secondary level of prevention. And finally, a tertiary level of prevention, that's really about preventing further deterioration and maximizing the quality of life. And I think one way that we achieved that this semester was with our seniors at Good Sam. Many of them, have diabetes and some of the comorbidities that go along with that. And it was really important for us to teach them about nutrition so that they could prevent, the worsening of their diabetes and the things that go along with that. So, we really worked with them closely on that. And, in community health, I think the thing that I took from it the most, during this clinical, we also had to do a windshield survey and data collection around a certain area of San Antonio. And what I discovered in my particular census tract was that teen pregnancy is a huge issue in San Antonio and Bexar County. But my census tract in particular, the area where it was, the birth rate for teens is twice that of Bexar County. So it's already a problem in the county, but in this area it's even worse. And it really opened my eyes to, not only the prevention of teen pregnancy, but also the prevention of future pregnancies once it happens, because many teen moms, if it happens to them once, they're much more likely to get pregnant again very soon, within 2 years. So I recently accepted a position at University Hospital as a labor and delivery nurse, and I know at that hospital many of my clients will be teenagers, and I would love to get out into the community and work with teens to help prevent the teen pregnancy. But in the hospital setting, one thing I can work with my moms is establishing that they need to talk with their doctor about future birth control plans to prevent future teen pregnancies, and talking to them about safe sex practices, and offer them different resources. And that's something I can really pull from community health that I can take into my nursing practice in the hospital setting, because I'm going to be dealing with many different people that I will be at University Hospital. So I really enjoyed the opportunity in this clinical, and I learned a lot, and it was great. Thanks.